When I first learned of the pandemic, I was actually working on the unit. Things were pretty surreal, and I didn't quite know what the next year and a half was going to look like.
My daughter at the time, she's still my daughter, was going on a trip, a senior trip, because she was graduating from Bozeman High. And her and 4 girlfriends were going to New York City. And they were leaving on a Thursday. And that Thursday was the day they shut down New York City.
I was in a much larger city, and it was a place where people were wearing masks already and were, looking for supplies. You couldn't get hand sanitizer. The hotel I was staying at was being really strict, and when I came back, that's right when we had our first COVID-19 case in Gallatin County.
I had just gotten back from Alabama, from the Department of Homeland Security, where I was being trained on how to function in a hospital incident command system. I did not think that I would have to be using everything that I learned the day I returned.
I think there was so much confusion at that point and so much fear, and the first thought was, oh crap, here we go, it's coming. And it was felt like an all-out scramble to get ready for it at that point.
I just remember feeling like it was just crashing down on us, and I didn't know if we were prepared or not, because we didn't know how to treat our patients or how to keep ourselves safe. So I remember feeling very claustrophobic.
I think thanks to the foresight of our public health officials and their guidance, and thanks to the willingness of our community to do what it took, we shut down pretty early as a community, and that bought us time to prepare.
When I first realized that we were going to have to risk stratify who would get medical grade PPE and who would get PPE that was locally manufactured. And I had a moment where an extremely trusted colleague reached out to me to see if I was okay. And she looked at me and she said, "Do you think you're going to be able to keep everyone safe?" And that really was the catalyst for me doing some major internal reflection and finding a way to cope with the magnitude of the situation.
As the pandemic progressed, I really saw a lot of community support and compassion.
People started sewing masks. Other companies started donating their time and their equipment. And then I had friends reach out, and I have this mask in my garage that I use for painting. Do you want it? How many do you need?
Sims Fishing started making gowns for us that we were able to wash and reuse and wash and reuse. So it also was great that we weren't throwing anything away.
I saw in my colleagues, they were ready. There was a feeling of almost going to war, where everyone was mentally prepping themselves. We were talking through how we would handle it at work.
We pulled together to shut down all non-essential services, which was difficult. We had physicians and advanced practice clinicians and nurses working to rapidly learn how to use telehealth to expand our ability to continue to provide services to the community. And there was just a real drive on everyone's part to do the right thing.
It was a pretty wild experience to be working in a healthcare setting in a non-clinical role, helping sort of navigate the structure of our incident command and how we were going to be responding.
I had a very good support system in my family, and there wasn't a lot of anxiety within the home. I tried to kind of keep that out as much as I could and maintain a normal as life as we could while staying safe.
For us, I think like many families, it was really challenging to not be in the same shared space for a long period of time. But through that, I think from my family, I saw and felt a lot of love. And so I have the sort of experience of, with my friends too, even though for the pandemic I was alone a lot of the time and I never felt lonely.
I had an extremely supportive partner in my husband to say, you do what you have to do to meet the needs of the community. And I think that's the biggest piece that is missing when we talk about the healthcare workers and their response. They have an enormous support system behind them of people who significantly contributed and sacrificed to keep those healthcare workers going.
At a time when many colleagues were isolating from their family or moving out, or we decided we would go through it together, and I would take the precautions I could at work, and I would protect myself as best I could, but I would also come home to my family because we thought that was what we all needed then.
I felt like it was harder on my family, on my kids in particular, than here at work. You know, I'm a nurse, this is what I'm trained to do. So I felt like that it was handled here, but I saw my kids really struggle.
It was inspirational to watch team members who still came to work, but to watch them do that among the fear and the unknowns that we were facing then, and the personal risk that people were taking on then in the face of those unknowns was kind of heart-wrenching to watch. I had colleagues who were making videos for their kids, goodbye videos, before coming to work, not knowing what would happen. That's really hard to watch because they were doing it for others, but it was also inspirational to watch their willingness to come and show up and be there.
We have a 20-bed unit in critical care. We would mark our COVID patients with the red dots so that I would know, like, isolation, things like that. To see that there were more red dots on the board than regular patients, that was my moment where I remember feeling unrest.
The biggest challenge was just seeing people isolated and alone and having patients there without their loved ones and their support system. I can think of 4 times where I admitted somebody to the hospital who had already lost their spouse to the virus. And to watch the recognition in their face that they were going through the same thing that their recently deceased spouse had just gone through was something I don't ever want to repeat.
It's hard. I think the experience that many of us had is that it's hard, it was exhausting, it was scary. And every day, you know, you had to just kind of push through and be like, this is what I have to get on today, this is the way I can be helpful, and these are the things I can do to care for myself.
I just worked on the mission of what I was set forth to do, which was to keep our patients safe, to keep our staff safe, and to keep our community safe. And I didn't see any other options.
I was very sad for the people that I would take care of, that I would then read their obituaries in the paper. And that really disturbed me.
It's almost like everyone's going through a collective post-trauma. It was a traumatic year, and in some ways We didn't deal with that during the course of it because everyone put their heads down and pushed forward and kept working.
You didn't even realize what you were doing until like you get through it, and then you kind of have this little bit of a letdown, and numbers are starting to back off, and things are getting easier, and then you're able to kind of just. It was a feeling that just kind of washed through you.
I felt like at work I had to really reach deep and support my team members, and because that's really important to me. I don't really feel like I've allowed myself the time to really process it all, if you will. I feel like that I still haven't really processed it all.
When I heard that we were getting vaccines, it was a really strange mix of emotions. We had been sort of moving towards that day. Like everything we've been doing is we understood that like the only way that we were going to get through this pandemic was with vaccines.
It was such a celebratory moment that we didn't want to delay it till the next week. We didn't want to delay it even till the next day. We received those vaccines at the dock. We got them prepared, and we got those into healthcare providers' arms same day, immediately.
The day I got a call asking or offering a shot was phenomenal. It felt like, wow, there is an end. There is a way out of this. There is a way we're gonna return back to normal at some point.
Exciting time. Very exciting.
This was going to be a breakthrough. This was going to be a big thing.
I was excited. I was actually one of the first 6 here at Bozeman Health to get the vaccine, and I was excited.
To be the 6th person out of that 5-dose vial where we didn't even know that you could get 6 doses out of it, but when they got through 5, there was 1 dose left, and that was my spot. And to watch the joy on each person's face as they stood and bared their shoulder to get a shot, and knowing how much had gone into preparing that vaccine and how many people worldwide had thrown their effort into making that effort successful and bringing that to fruition, as a magical moment that I don't think I'll ever forget.
I sat down, I got that vaccine, and I was just ecstatic. And I cried, and I felt very lucky, and I felt just really relieved, and that like maybe we were on a path leading out of this.
Within that first week, the other providers in the emergency department, I think everyone had gotten theirs, and nursing staff were getting theirs, and others in the emergency department, and it was an immediate difference. I remember within a day of seeing people get vaccines, I noticed there's laughter, there's a levity or a different mood than there had been for what was 11 months at that point.
Christmas had come early, and knowing that with the initiation of the vaccines to frontline workers, I knew that that meant behind it would be other members of the community and that we could get back to normal sooner. I was just praying that everyone would be as excited as I was for it.
It wasn't the day that got me when I got the vaccine. It was the days after I got the vaccine, where I think I really allowed myself to feel the magnitude of the year prior. I was grieving everything that was lost the previous year, the time that was lost with my loved ones, and the security, just my own internal security that I lost last year. I lost my grandma in 2020, and there were so many things that I hadn't processed, And it was that moment of getting the vaccine that I really started grieving, and I really started healing as a person. So I wouldn't say that it was the day that I got it, but it's been all of the days after I got the vaccine that I've processed it all.
I think the pandemic changed me. I think it probably changed all of us in different ways.
I'm more committed than I ever have been to assisting my community in its quest to be as healthy as possible.
I think I'd probably try to focus even more on the people. I'd like to think that I've always done that, but I think it recentered me on the people, the patients, and those that I work with.
I think it made me more grateful for some of the smaller things, the normal things, even just seeing my friends' faces, the animation in their faces.
For me, that sort of call to public service, that sort of call to action has been cemented in maybe ways that it wouldn't have been if we didn't go through this experience together and we aren't still moving through this experience as a community.
It's taken a toll in a way that we've lost some really amazing nurses. Some have gone into early retirement. Others have left the state entirely. And so that's sad, you know? So although it feels lighter and the burden feels lighter, it definitely has left some scars.
I really thought, this is our moment. This is when we're going to be able to see an end to the pandemic. And little did we know that it really wasn't the end.
I've seen more COVID in the last couple of weeks than I had in months, and I think the same goes for my partners. It's easy because I know our team is safe. I feel like we know what we're doing, we know how to keep ourselves safe, we're good at this, we can help these people. It's also really hard to see people getting sick at this point with what is now a vaccine-preventable disease. The vast majority of the people that we're seeing with cases, had they been vaccinated, they would not be sick. And now they're sick, they're uncomfortable, they're scared, they're being admitted to the hospital sometimes, and it's hard to see that when you know it could have been prevented.
I think everybody is being a bit re-traumatized going into this fall.
It's been around long enough now that you can't help but be educated about it.
Think about yourself, but also think about everyone else around you. When the vaccines came out, I and most of my coworkers who saw firsthand the effects of this virus were first in line to get a vaccine. The perceived dangers of the vaccine are so much less than the real, very real dangers of this virus. Talk to your medical provider, get information from your medical provider, from somebody you really trust. Also think about those you can protect by vaccinating yourself. You protect yourself, you would protect those around you, and that helps everybody and protects all of us.